I'm Ranjani Harish. I work in the Department of Translational Research as a research officer at Madras Diabetes Research Foundation, which is in Chennai, Madras, India. And I am in Atlanta. The diabetes and obesity landscape in India is definitely escalating. And as everybody knows, in fact, IDF is going to be coming out with a new diabetes atlas in Montreal this year. And I mean, we're quite sure India is still going to be the top ranked country there. So it's not something we're proud of, that we're capital, diabetes in the world, but it is the fact. It is westernization and urbanization together is one of the main problems of the escalating diabetes and obesity twin epidemic. And this is not just, that people are not exercising as a whole. It's just that even the small things that they used to do before, they don't do it anymore. So if it's a walk from their building to a bus stand, or walk from their building to the railway station, or walk from the station back to office, you have rickshaws standing right outside the station or right outside the bus stand waving out to you. We're doing a project on lifestyle improvement. In fact, that was we called it specifically that because we thought we'll say lifestyle intervention program, but we realized intervention is not a word people understand. We want to improve people's lifestyle. So that's the reason we called it DCLIP, which is Diabetes Community Lifestyle Improvement Program. Many people keep asking Dr. Mohan that, you're doing prevention, how you're not going to get patients, if you want to go and eradicate diabetes off the world, so how are you going to run your center? But he just says the numbers are so high, there's just no way that we can prevent the whole thing. We had a bank manager who's part of this project, and he gave us one of the biggest compliments. He came and told us that, I used to just sit in my table and make calls to people every time I need a paper, anything. Now what I do is I get up, we've given them shoes. So he says, I wear the shoes, I go to office and I change it to my DCLIP shoes, and I walk up and down. So every time I need a paper, I go to a person's desk, and so suddenly he had some 300 people working under him, and everybody said, oh, the boss has come to my table. So two things happened. One, they realized he's taking the effort to come to them all the time. So they were quite happy that he's giving them that much importance. So he realized the productivity increases because every time suddenly the boss is coming to them all the time. So they have to be on their toes because why is this chap coming running to me every second time? So he said, and it was fantastic. And then he finally had to tell them, no, don't get hyper that I'm torturing you all the time. So this is the reason I'm doing it. And people got interested. They said, oh, okay, not bad. So we'll also do that. So you have extension numbers in offices where you just a room across the hallway and you're calling people and asking, you just take that small walk, that would do. So those are the kind of messages we give people, and there are people who are following it. There are people who are ready to listen to you. Many people do not really know much about diabetes. So because the awareness is lacking, when somebody in the family actually gets diabetes, they don't realize how economically burdensome it's going to be for them eventually. This you'll get, a better view when you talk to your patients, where they've gone through the whole stage where they knew nothing about diabetes, and suddenly somebody in the family has diabetes, and they realized how economically burdensome it is. And again, because of this economic impact of diabetes, we have even insurance for diabetes, which has come up in India. You have diabetes insurances. Interestingly, I was offered a job for diabetes insurance. I didn't take it up. The company asked me, saying, you have so much experience in diabetes, would you like to sell insurance? I said, sorry. You have very limited choices in the supermarket. You don't really have healthy choices in the supermarket. So I tell them, don't eat white bread, eat brown bread. But again, the brown bread also has sugar in it. It also has maida in it, it's refined flour. So it's very difficult to get very healthy choices. So as I said, we can't have them starving all the time. Fruits nowadays you have so many, everyday incidents of pesticidal residues, and people, having some kind of problem with fruits. So they're always concerned is, what do we actually eat then? I mean, you tell us to eat this, but this is also unhealthy, or this is poisonous. And so those are one of their major concerns, and it's a concern we share. So again, at Dr. Mohan's, at MDRF, we have a full-fledged nutrition department who's looking at glycemic index of foods and trying to come up with innovative stuff which can actually be used by consumers. But we need more players who do more these kind of things than rather than saying no, because you have to offer them enough choices. We've done market surveys. Again, the nutrition department at our nutrition research department at our center did that. They just randomly picked up a lot of supermarkets around Chennai, and they surveyed what kind of foods are offered, and it was 80% high carbohydrate refined flours something or the other was, basically it was mainly starch and refined flours in 75% of the foods. The healthy options were almost, I think, 10% or something like that, which is, what can you get? I mean, and those 10% would most often or not be expensive. So there are only few people who can afford that. So we need to improve a lot of things from the supermarket point of view, get in a lot of healthy options, which are also tasty for the consumer. So those are things that, from the patient point of view, the most common concerns are that, because till the starting stage, it's always they lack in awareness. They don't really know what diabetes can do to them. When they're told that, the next thing is always the money and, what are the options then. When you come to lifestyle changes, it has to be a small behavior change, which is to do either with your eating habits or to do with physical activity. See, when you say exercise and you say diet, they are actually words which are very, they have a short meaning. For them, exercise is, oh, I have to go to a gym, and it's very difficult for them to say exercise is just simple walking. Walking is walking. Exercise is you going and lifting dumbbells, or you're lifting some kind of weights, and I don't have time to do that kind of exercise. So then we had to, get them out of it and say, no, exercise is nothing but just improving your physical activity. So you do swimming, you do walking, you do badminton, anything is exercise for you. Similarly, diet is a very, very, I just don't like the word, because it's not the right word. When you say diet, the moment they feel, diet gives a very negative connotation. People think diet means they're forbidden to eat a lot of stuff. Rather than saying diet, just say healthy eating plan, or a good nutrition, good healthy plan, nutritive plan, and things like that. Then what we do is, again, it's a positive connotation to it, because we tell people you're supposed to eat all these things. We never use the word no at all. Or we say, instead of this is what you use. So these kinds of examples, when we give people, it's easier for them to follow it. So these are one of the main things that we tell. Like every small common sense thing we tell them is something they knew, like you'll see vigorous nods on their head, but they never did it. Simple things like taking a small plate, to reduce your serving size. Patients will say, oh, you're scaring us. The point is not to scare a patient. Diabetes is very much manageable, as we keep saying. Unfortunately, it can't be cured. Again, people are working towards it. Dr. Mohan again keeps saying, no, don't say it can't, because we always say, oh, it's only preventable and manageable, it cannot be cured. It's not that it cannot be cured, it's people are working towards it. Once people, take stock of their own health and realize, okay, this is in my hands and I can manage it, they are the patients who do not have much problems. But patients who take it very lightly, who think, oh, it's just diabetes, and I just have to stop eating sugar and nothing, then everything will be fine. They're the ones who don't realize the sugar is there in everything. We are mapping whole of India to study the prevalence of diabetes. So this is going to be the first study which is cut across whole of India, north, south, east, west, getting actual prevalence estimates in each state, rural and urban. We feel this is going to be one of the most pioneering work for people to realize the prevalence of diabetes, because people saying India is prevalent, diabetes is high, but nobody's buying it still. So we need epidemiological work to show the numbers. Using that epidemiology work, then we need to do a lot of translational work to take these, whatever we've studied and what we've researched, to the communities and definitely improve the awareness.